Greetings. My name is Kristen Tully, and I'm a researcher at the University of North Carolina at Chapel Hill. It's an honor to connect with you through the Maternal Health Learning and Innovation Center. I appreciate this opportunity to explore our shared interests in better serving families across the United States and beyond. I'm recording this presentation in September 2020 on behalf of the 4-trimester project team, which includes Sarah Verbees, Suzanne Woodward, Kimberly Harper, Alison Stubbe, and others alongside myself. I'm delighted to be working as part of this community to be impactful. The objective of this session is to share our work around newmomhealth.com, to offer the open access site as a resource for postpartum health and wellness. I'd like to start off by showing the homepage here, and also then offering some context to share our understanding of the need and then the way that we co-design this tool. And then I will come back to the site to share some features. So first, going from pregnancy, labor, and delivery, or otherwise bringing baby home, is a big transition. For birthing parents, it's a journey with changing hormones, recovery, body image, and new roles. All of this happens while learning to feed and care for a newborn in the context of fragmented sleep. And mothers and infants are dyads, highly integrated systems, not separate individuals with compartmentalized needs. And healthcare professionals are striving to care for them in the ways that they deserve. Health domains have usually been siloed. Clinicians and other practitioners typically assess either the needs of the child or the needs of the parent, and then there are specialists for the various areas, with guidance that unfortunately often conflicts with one another. It's like the blind each feeling only a part of the elephant, and subsequently having very different images of the whole. To be effective, we must consider birthing parents and infants in context, including acknowledgement of their overlapping and competing interests. Healthcare needs to be in service to the reality of whole people and families. This means that the interconnected health domains should be addressed together with integrated services and social support. Right now, we do not do enough to enable safety and health. We have 4 million births in this country each year in common health needs, yet there is a striking lack of continuity in maternity care. Professor Stubbe uses the analogy that women are being treated like wrappers. Once the baby is born, we are cast aside. We leave mothers too much to their own accord, and this impact of the gap has been deeply felt by too many for too long. It is totally unacceptable. At the core of these issues is equity. We have different access to care and different barriers to achieving personal goals. Having a baby does not feel safe and is not as safe for some as it is for others within this country. This focus is required to support the most marginalized groups, and in doing so, we elevate care for all. There are extensive unmet needs. Systems are perfectly designed for the outcomes they are achieving. So what does it say about us as a society when there are so many bad preventable outcomes and widening disparities? Right now, maternal health is in crisis. and statistics don't do real pain justice. Our work is about identifying challenges in the transition to motherhood. This is especially relevant with those who are underserved. And then we determine how we might best promote health while respecting family preferences and constraints. This is all about meeting people where they are in every sense and establishing quality systems of care. Leadership is leading with resources. Advancing patient-centered care means centering the voices of patients and healthcare providers. We are all at the table. We've intentionally approached partnership to make connections not only possible, but enjoyable and meaningful. And we continually improve this process in an effort to truly engage, to hear what is being shared, and to act on those priorities. The work is about transforming maternity care, and that means we change health services, and we recognize that this process changes us too. Part of what we heard through our Patient-Centered Outcomes Research Institute funded work on the days, weeks, and months following childbirth, the fourth trimester, is that we have extensive information on what to expect when we're expecting, and intensive monitoring of symptoms during pregnancy and delivery. But then there's a cliff. The little patient education for what's typical, concerning, or an emergency for women after birth is generally provided in a very short window of time, in the hours after birth when you're tired and coping, and with a lot going on around you. And those pamphlets that you're provided might get lost, or the booklet might only be skimmed. This is important because you can't prepare for something and know what to do if you aren't educated in it. High quality healthcare is a human right, and you shouldn't have to Google to know if you're in danger. We can and must do much better than that. We envision a world where every birthing parent receives the support that they need. This image shows some of the pages on newmomhealth.com, which is one of our programmatic steps in changing the way America treats new moms. We co-designed this site by moms for moms so that the images, the layout, the tone, the content are appropriate and useful. All parents deserve support. newmomhealth.com is an online village for learning new information and planning. And the bigger purpose is to demonstrate value and respect for each other. This slide and the next few show some of the sections, and each of them have subpages within them. These ones are all about areas of maternal health, including communication. We have a section for information on COVID-19 with symptoms, evidence to inform decision around birth practices and breastfeeding, and also to validate what it's like not having the experiences and opportunities that we might have had in the before times. So part of this site is about, emotional health and actively looking for the joy. Other components of newmomhealth.com include baby care in relation to the whole family, and including mom's feelings and needs, as well as consideration with siblings. And this section also has information for parents who are encountering intensive medical care or loss. Another section is about milestones, relationships, and information and tips for jobs and school. We offer ideas for seeking out and connecting with other new moms, and we have a lot of fun sharing and learning on social media. Information for the fourth trimester project on Twitter, Facebook, and Instagram are provided here. Our UNC email address is also offered for trimester at unc.edu in case that's of interest. We're continuing to add and refine content, and suggestions are welcomed. And there's a feedback section on the site. And we're excited to have New Mom Health be useful as part of maternity care, as well as being accessed by doulas and other key supports and family members directly. So to wrap up, I think we're connected right now with this because we're compelled to do more than map needs. It's thrilling to be a part of real change. And the Spanish version of the site is forthcoming. It's launching soon, so stay tuned with that offering and other opportunities and news. Thank you very much.